adults have gotten a Tdap. Some of them may have gotten a tetanus, diphtheria, and that was required for a long time, that was it. But with the rise in whooping cough in kids, and adults being silent carriers, then there's a move back to make sure adults get this. So these recommendations get a little confusing about what to do. In 2015, 18,000 cases of whooping cough, and in the spread to infants is the main concern. Tetanus, you're familiar with lockjaw, and that it is very deadly. And vaccination has dropped it almost to by 99%, so very effective. Diphtheria used to be a very, very deadly disease. I showed you a picture down there in the bottom from probably the 1940s, before we had a diphtheria. Corynebacterium leads to all kinds of difficulty breathing, heart failure, paralysis, death. Vaccinations, again, have dropped that cases by 99%. So here's the whooping cough. So Bordetella, pertussis, severe coughing spells, pneumonia, death, newborns at the greatest risk. Of course, you all don't watch TV, so you don't see the commercial with the big bad wolf, grandparent. So this grandparent gets a call. She's got a new grandbaby, and she watch her in her car. She's driving. She gets closer. She's coughing, and she transforms into the big bad wolf. She's holding her baby, and so they're showing you the transmitting this to the newborn. But since you all don't watch TV, you haven't seen it, right? Anybody seen it? Anybody know what I'm talking about? Okay. All right, so let's look at the recommendations. So the acellular pertussis part is inactivated fractional subunit. The diphtheria and the tetanus are toxoids. So they're about the only two that come that way anymore. So adults, when you get a history from them, you want to know when did they have their last Tdap or tetanus diphtheria. If they have, so here's where the differences for adults come. If they have never had Tdap, it's recommended you give it to them then, regardless of when they last had a tetanus diphtheria, especially if they never recall having Tdap. If they are near their schedule, their 10-year, and they've not had Tdap, it's recommended you give that. If they've had Tdap in the past, then they can have just get the tetanus diphtheria. So it's recommended once for adults. In pregnancy, they recommend you get it every time you're pregnant, between the 27th and 36th week gestation. So third trimester. Everybody clear with that? It's a little bit weird. So there's lots of tetanus diphtheria in the United States. There's 2 Tdap vaccines in the U.S., the Varicella and the booster. Okay, so remember, these things that we're going through are for adults, not kids. So here's the measles, mumps, rubella. Anybody born before 1957 is considered to be immune because usually they were exposed. The only exception that I now see the CDC inserting in there is if they're healthcare providers, they ought to show immunologic or laboratory evidence that they still carry immunity. So you know all these are viral. You see the signs and symptoms. The problem with adults in mumps is that they can cause sterility in males. So we want to make sure that they are vaccinated. Measles can be very virulent with causing encephalitis and death. Rubella, if a pregnant woman gets that, her child has a very high likelihood of having congenital defects. So often women should be encouraged, if they weren't vaccinated, is to have a titer drawn before. And if they are, and they usually will draw a titer during pregnancy, and they'll tell you. They won't give you the vaccine, but as soon as you delivered, they will then vaccinate you. Vaccinations reduce the risk by, or the incidence by 99%. We still see little outbreaks from time to time. So let's see. Indications. So the indications with adults is just a one-time vaccination. Who should be vaccinated? So international healthcare professionals, women of childbearing year who were not vaccinated. This is an important one to ask about in your history with adults. If they are in or around immunocompromised people, where they could transmit the disease. People living with HIV who have not been vaccinated. Or students in college or other higher education environments. Questions about those? Okay. Varicella. Again, this one came out in 1995. Anybody before the age of, or born before 1980 is considered to be immune. Again, with healthcare professionals, they have the caveat that they should demonstrate immunity. So varicella is a live attenuated. So who are we not going to give it to? Immunocompromised pregnancy. I think with this one, they recommend that you not get, there's a length of time that you don't get pregnant after you receive the vaccine. So for this one is a 2-dose, 4 to 8 weeks apart. Indications for administration, again, healthcare professionals, people who are in or around immunocompromised people, teachers, child care workers, because it's just so virulent. Do any of you all have chicken pox? Good gosh, did your parents not vaccinate you? No?
I got it before the vaccine.
You got it before the vaccine. Ah,
right around the vaccine.
Before the vaccine. Okay. You're not that old. Okay.
Hey!
Residents and staff in nursing homes, residential, college students. So again, you'll see where people are congregated in, lots of people in small spaces where they would interact a lot. Military personnel, women of childbearing age who are not pregnant. Herpes zoster. So the one bad thing about having chickenpox is you're at risk for getting shingles later in life. So you know what is shingles?
Reactivation.
Reactivated.
Herpes zoster.
Herpes zoster, or in the nerve endings. Okay, very painful. Anybody ever taken care of or witnessed this with somebody? Anybody ever have it? Youngest I've seen is 14. How old were you?
I was 12.
12. Wow, you're as young as I've heard. Wow.
My sister was about that age too.
Did you have chicken pox? Your sister was 12 too? Did you have chicken pox as a kid?
Yeah, I had it when I was 6 months old.
Oh, wow. Wow. Okay. So it usually comes in a dermatome, you know that. The big risk is, well, they're very painful, very itchy, very intensely painful. That's the early episode, and then you've got the post-herpetic neuralgia that can last for months to years. So my mother had shingles, and she had that post-herpetic neuralgia for 2 years. It was awful, awful. And she had a dermatome that went around from her back, across her hip, and down the inside of her leg. It was just awful. It was just a misery. So very common, herpes zoster, 1 million cases in the United States every year. Goes up with age, so 50 and 60-year-olds. 60-year-olds are about twice the risk of 50-year-olds. The post-herpetic neuralgia is defined as persistent pain for at least 90 days. Good gosh, you got to get out 90 days before you hit the mark. Very common complication. You see it's in up to about 15% of people who have the shingles. 2 vaccines. So this is new. So Zostavax came out probably 10 years ago. Live attenuated vaccine. It was indicated for those 50 and older. They have moved that to 60 and older. One of the problems is that it's just not very effective for very long. It's thought that the effect attenuates after about 5 years. So that's why they're recommending it for giving it at an older age instead of at 50. The newest vaccine came out, it's called Shingrix, and it is a recombinant vaccine with an adjuvant, so again, to boost the immune response. It is much more effective. So a couple of questions that come up a lot. Can you get the shingles vaccine after you've had the shingles? Yes, you can. One is to decrease the risk of having a second infection. Can you get Shingrix after you've had Zostavex? Yes, in fact, they recommend it. So the Shingrix is thought to maintain a response for up to 9 years. So we'll see. It hadn't been around that long, so we'll see if the recommendations change over time. 90% efficacy at least 4 years out, and 88% of efficacy 70 years out. If you look at the number needed to treat, you can see where the big difference is. Zostavex is 1 in 59, and Shingrix is 1 in 37 for younger patients. So it has a different age range. Yes.
If you get both, do the patients have to wait in between a certain period?
I think I put that down. I don't have it in my memory. 8 weeks. It can be given as early as 8 weeks after Zostavex.
Thank you.
Doesn't matter if you've had chicken pox or not had chicken pox, is recommended. They're really expensive. Zostavex is very fragile, it's live attenuated, has to be drop shipped in dry ice. Pharmacy has to keep it under certain conditions. You're shaking your head. And usually they recommend you come by the pharmacy, pick it up, and go to the doctor, or the pharmacy can give it. Do you all give them?
Yeah.
They cause nasty reactions, big. I mean, it's just like having chicken pox in that one spot. They're intense. Okay. Questions about those? Not as good at reducing post-hope traumatic neuralgia. If you look on the next page, top of 6, number needed to treat is 1 in 350. So still worth the price. Do you all carry the Shingrix?
No, we don't.
Did you see it at your pharmacy?
When I stopped working there, we didn't have it yet.
They didn't have it yet. Came out in October of 17, I think.
Yeah, so we probably got it 6 months later.
Okay, that's an important one. Please pay attention to that. Because that's one of the ones there's a difference between that one and last year. Okay, so HPV. So the big thing with human papillomavirus is that it's a common cause of cervical cancer. So having a vaccine that would prevent or decrease that risk has been quite an advance. So about 14 million teens infected a year, 30,000 people affected by cancer. So quite an impact with this vaccine. So there's 2 different types. There's the Gardasil 4 and 9. The number tells you the subtypes or serotypes of the HPV virus that it will protect against. So indications, so they keep upping the upper range especially for women. So they recommend now that females between 13 and 26 be vaccinated. In men, it's now up to 21. The difference is in certain populations. So for those that claim bisexual, men who have sex with men, transgender, and immunocompromised, they're recommending for them to go up to 26 years of age. So I take that's for the men. 3 doses is recommended. Question?
I think we were talking, I think they just upped is it for people that have never had any of the series, it's like age 27 to 49 are now approved by the FDA to get it.
I didn't see it. I looked to see if there was.
It's very new.
Let mean, I just looked at the
Did you just now?
CDC. It's not, I don't think it's on, look on the CDC website.
Probably saw it on Facebook.
I know,
so
me
why not?
too.
It says it happened on October 5th, so.
I resisted
October fifth.
Googling things for a long time instead of going right
Okay.
to the scientific
I
literature.
think also if you like start the series and don't finish it, you can still get it, you can like finish the series.
Right, you can
even if
finish the
you're,
series
like,
and
up
don't
to
have to start
series
again.
something.
Is that it?
Okay, I'll let you look
Yeah,
at it while we're,
27.
Yeah.
because it's one of the ones I watch, because they have, it's been such a change for the last few years.
This is from New York Times, and it came out on October 5th, and it says,
Okay.
for men and women from 27 to 45 years old by the FDA. Trying to see if you've had this series at all. Approval is based on this.
Now, see, the FDA approving it, and
Doesn't
the
mean-
CDC and the Committee on Immunizations adopting it would probably be different.
So it looks like this is coming from the FDA saying that the vaccines were still effective in that age range, so they could be given in that age range.
Okay.
When I think previously it was just for the younger ages.
So it's not as easy.
Let me make a note.
Yeah, I don't think you're right.
I know
It's not
that, I know the
CDC, it's
CDC has
FDA.
one.
Yeah, because at the bottom it says, once the advisory committee recommends it, then the insurance will start to cover it for those people.
So maybe next year we'll see it in those recommendations. See, the FDA is not going to approve it unless they have data.
Yeah.
So they must have they must have put in an amendment to their new drug application to do that.
So is it that the FDA will recommend it and then the CDC, or how does that?
So what the FDA, so going back, think about what the FDA is. The FDA is the body that approves drugs. They also approve indications, so we're always talking about FDA indications. So people can go out and use things, but we'll say they're not FDA approved. So insurances sometimes will take that tack. We're not, if we're gonna, is too far out for us and it's not mainstream enough, so we are not gonna pay for it. So for the company to market it, they would have to come back to the FDA and submit data and say it is still effective, or it should be given and it's effective. So saying that it still provides protection is different from saying you can then immunize a 40-year-old.
Okay.
Okay, so not to parse words, but there's a difference in those. So if the FDA says there's evidence of that it still protects when given to older ages, then the committees can sit down and go, well, okay, now we'll approve or not approve. But that subcommittee, all they'll do is make a recommendation to CDC. So you got 3 governmental agencies that will look at it. Okay, so we'll go with what's in here for testing. Okay, pneumococcal vaccination. So there's 2 of them. So there's the Pneumovax, which is the 23, covers 23 subtypes, and there's Prevnar 13. So these also get confusing. So for all adults over the age of 65, they should get both of them. You cannot give them at the same time. There's a length of time that has to last. They recommend if you have the ability to choose, you start with Prevnar, and then I think it's a year later you can give Pneumovax. Pneumovax is recommended for people under the age of 65 who are at high risk for pneumonias. So that would be people that are immunocompromised, dialysis, diabetes has that recommendation. So lots of different chronic diseases also carry that recommendation. So let's say at the age of 50 you got the Pneumovax because you have diabetes and your doctor gave you your Pneumovax. When you turn 65, you get it again, as long as it hasn't been 5 years. So if you got it at age 64, at age 69, you would be eligible to do it again. These recommendations have gone all over the board because I think they just don't know. So they're hedging their bets. So that's the difference with Pneumovax. Depends on when you got it. You get it before 65. And if you do, you get it again after 65. And you need at least 5 years in between. Prevnar is also recommended, and give it first if you can. All right. That's an important one. It's one of those big quality indicators. Your hospital, your facility will be judged on how many people you have vaccinated with Pneumovax. So that's why I'm saying it's always good to tie it to the flu vaccine. You give the flu vaccine, you ask the person, have you had a Pneumovax? And if they haven't, you can give them at the same time. Only 20% of people have received it. Lots of hospitals have big pushes on it, quality indicator. So the different governmental agencies, the different people who give you your report cards as an institution, look at certain quality indicators. This is one of them. So Pneumovax is a big deal, especially in institutions. Okay. Hep A. Probably most of you got it as a baby, because now it's part of the regular vaccinations for kids. But a lot of adults, older adults, would not have gotten them. So people who should get hepatitis A, it's highly infectious. If somebody gets it, it just will go through a group. Like, and a common place would be healthcare, daycare workers, because it has a fecal spread. So very acute, yellow skin, eyes, fatigue, nausea, makes you very, very sick. But most people usually, if they were healthy to begin with, usually will recover. All right, so the Hep A indications for people who live in a community with a high rate of hepatitis A. Men who have sex with other men, people who use street drugs, share needles, travel to countries that have a high incidence, have long-term liver disease. If you take, if you are hemophiliac and you have to rely on blood supply for your clotting factors, they're at risk. Those that work with HIV-infected animals are in research settings. So this one is a 2-dose over a year and a half period. The other big vaccine is hepatitis B, which probably a lot of you got as a kid as well. So this is chronic. And this one is so much more higher morbidity and mortality associated with it. So Hep B. And people can be carriers or they can have the chronic illness. So it manifests itself in all different types of ways. High fatality rate in middle-aged to older patients. Commonly goes along, if you think back to Hep C, when we get to HIV, when you get to a lot of immunocompromised states, one of the things they will recommend is you also test them for hepatitis B. Remember back when we did rheumatoid arthritis and all those biologics, one of the things we tested for was TB, right? Hepatitis B was another one, because you can activate it. A lot of the drugs we use with Hep C can activate Hep B. So a lot of people are carriers. They don't ever get sick, but you can activate the disease if you immunocompromise them. So this one is a 3-dose, 3 different vaccines given over a 6-month period. It's a good one to ask. If you're a healthcare worker, you'll have to have it. If you haven't had it, they'll make you get the series. You're dealing with blood products in particular. Meningococcal. So did you all have to get that when you went to college? Yes, a lot of you are saying yes. That's good. It is a nasty disease. When I was a resident, I did a month with an infectious disease, and I saw one of these in a really young girl. She was the youngest of 3 daughters. She was probably about 12 years old. Got it overnight, you went to bed, didn't feel good, woke up, rash everywhere, and over the next few days she just auto-amputated all of her fingers. She eventually died. It was terrible. That's exactly what her fingers looked like at the end. So a nasty, nasty aggressive disease. high fatality. So this is one of those that I would make sure that the kids get them, and young adults, or those that are going to be like in the military or they're going off to college. You'll see on that last bullet point, those that have anatomic or functional asplenia, they've had their spleen removed for other reasons, would be people who would also need that vaccine. Last one, H-flu. So H-flu is not very, we don't give it to adults very often because they don't tend to get it unless they're immunocompromised. I would say alcoholics, people that use a lot of street drugs will tend to get this as a pneumonia. So not very common for us to give it to healthy adults. Those at highest risk, the asplenia, people who've had stem cell transplants, but it's out there as a recommendation. Okay, questions? This is going to be the hardest one for you to study because it's detailed. Okay, so look at those objectives. You can do the common good and the public a good service if you will keep up to date or keep up with what kind of vaccines. I'll tell you for the most part, if I didn't work in healthcare, I wouldn't hear about most of these. And mostly, I never hear about it out of a doctor's mouth. Or anybody I've ever seen, they've never. I'm usually the one going in there, I want this vaccine. I'll take any that they give me. Anything I can do with my immune system, I'm good to help. Okay. All right, so the last one